Welcome to this episode of Pondering, Play and Therapy. And this week, my guest is Jasmine Williams, who is based in Queensland. So we're on hugely different time zones at the moment. It's 10 p.m. for me in the UK and 7 a.m.
Yeah.
for you, Jasmine, in
Yes, 7
Queensland.
a.m. Mm-hmm.
And Jasmine is a play therapist, a teen counsellor, an animal assisted therapist, and has been a teacher for 20 years. So
Yeah.
you've been in play and working with little ones and all that for
Mm-hmm.
quite a number of years. Jasmine, that's a winding career.
Yeah, well, definitely. I'm definitely an advocate for play, especially play-based learning and play as a therapy model, definitely.
So, did you go from teaching into play therapy then?
I had a little bit of a gap where I was lecturing at our university, like lecturing into the education degree, and then COVID happened. And I thought, oh my goodness, what am I doing with my life? So I did a bit of a postgrad study in child-centered play therapy and opened my business and haven't looked back. It's been the best thing I've ever done.
Okay. And
Mhm.
so teaching, did you go into teaching? Is that your first career really?
Yeah, so I worked in what we call over here as childcare. So working with really little children, and then I just continued studying and then went into teaching. Primarily, though, I liked to teach the kindergarten children. So that's our before school age, that year before school, because it was still play-based learning. So that's where I really sit well as a teacher through that play-based learning.
and is that what led you then into play therapy?
Just seeing so many struggling families and children. We just have growing number of children with complex needs and especially trauma as well. So just wanting to help children from that individual perspective instead of in a classroom. In the classroom environment, you don't have those opportunities to help as much one-on-one. And yeah, so that's why I did my postgrad, just to be able to help more children and more families.
Yeah, and then so you became a play therapist, and then you've
Yeah.
added. Is the teen counselor? Did you do that during the teaching, or
No, so that's new. I've expanded into that this year just because we have in our area, in our community, just a really high need for services that support children from like birth to teens. And teens are an age group that are missed a lot because we've got a lot for early childhood, then we've got lots for young adults, but that teen age group are really struggling to find services. So I did some further study and got my postgrad dip in counselling just to go along with that. So then I can counsel the teenagers. I will still do it as a play-based model, though, however, so it won't be standardized talk-based therapy. It will still be very much child-centered and play-based using sand tray therapy and things like that.
so if you've got a parent or a clinician
Mhm.
that was listening and they didn't really know what that meant, what does it mean when it's not talking? Because I guess most people are think of therapy as that you come along, you sit on a couch, somebody
Yeah,
says, "How are you?" And you say, "I don't know." And they say, "Tell me more
yeah.
about it, lie down." But
Hmm.
you're saying actually that's not the type of therapy that you do. It's
No, we come from a child-centered model, so it's non-directive. And our primary focus when we first meet a client is to establish connection. So that is our primary focus at first, is to establish that connection. So there's trust within that therapeutic relationship. And then the journey will begin from there. So we do talk and reflect and build on things that are happening, but we don't directly ask questions. So we let it unfold through their play or interests or games and just the way that they are within that therapeutic space.
so how would you play with a teen then? Because I imagine lots of people again, if
Yeah,
it's
so our environment is
teen.
completely different. So it's very interest based. We have lots of board games, we have sand trays, we've got sand tray therapy, lots of arts and crafts. depending on what the child is interested in. We also do a telehealth version as well, which adds a whole nother dynamic doing it via Zoom or Teams. We want the child to establish trust in the space through whatever outlet they need, and then that's how the therapy process unravels.
So could that be like playing games like Uno or
Yeah,
Scrabble?
we have a huge range of board games, and it's something that they will need to decide on. So we want to facilitate their decision making within the therapeutic space. That's the same as our play therapy clients as well. They need to facilitate that decision making to build that sense of agency and confidence within themselves. And that can be some of the hardest things to do in the beginning stages of the therapy process, is just actually deciding what they want to do.
Mm.
But that's part of the process as well, to help build that confidence and trust within the space.
So
Once
how
they've
do you,
established,
go on.
pardon?
I was just
Once
going to
they've
say,
established trust, they everything will come to the surface through them.
but sometimes I imagine sitting with the unknown that
Mm-hmm.
teens can come with can be quite difficult because
Yeah, it
lots of it
definitely.
is I don't know, or even if they know they need to be there, I imagine it can be quite difficult for a teen to be in that space and be
Yeah.
noticed because part of being a teen is you're so self-conscious
Mhm.
anyway, aren't you?
Definitely, but that's part of the process too. They need to know that they are in a safe space, like it's their safe container, and they can just be in the space if that's what they need. Through a lot of reflection, so we reflect content back constantly in those first stages of therapy, that, oh, you're struggling to make decisions, you're a bit unsure in here, and just reflecting so they know that they're seen.
Yeah. And when you've got little ones,
Yeah.
is that when you think about play therapy, I guess lots of people imagine that they come along and they've just got all these toys and they just run around and do stuff, and you sit there saying, "Oh, I'm wondering why you're playing that," or what is play therapy like?
So it is a room full of resources, but they're specifically chosen resources and set out in a specific way. And obviously, no two children play the same way. It can be very different for every client every single day. They do engage in play. We do a lot of reflecting content, reflecting emotions, and returning responsibility. But then also, we're observing and tracking the play as well to watch for themes of play, because they will move through 4 stages of play in their therapy process as well. So there's lots of reflecting on what we've observed, as well as what we're saying and what they're saying and doing in the therapy space.
And what is the purpose of play therapy? Why would somebody come and do it?
Oh, so they can come for various different reasons, whatever issues the child is struggling with. So we have lots of children come to us because of trauma backgrounds. In Australia, we have something called NDIS, where it's a funded package for children who have complex needs or disabilities. So we have NDIS children come to us, we have private children, referrals from hospitals, a huge range of reasons they come to us. They will all still move through those 4 stages of play.
So, what are the 4 stages, Jasmine?
Yep. So we've got exploratory stage. That's where they're exploring the space, exploring the relationship, building connection. Then they move into an aggressive stage of play. That can be exactly what it sounds like. They are playing more aggressive or with aggressive toys, but it's not always the case. It might just be they need that power and control in playing a board game or in their individual play. Then they'll move into the regressive stage of play where there's more nurturing and caretaking themes. So you might still see those aggressive themes, but you'll see some more nurturing themes presenting in there. And then mastery is where they will transition out, where they have complete confidence in the therapeutic space and relationship. They've built that confidence and sense of agency, and there should be shifts, significant shifts in outside environments. However, we are not magicians. There needs to be change in the outside environments as well for the whole therapeutic process to be that really positive experience and life changing. If they're still returning into outside environments that are having negative impacts, we can only do so much. Yeah.
Yeah. So, what if somebody was listening to this, so a parent, and they hear
Mhm.
those four stages? I guess they're wondering, well, how does that work? What is that about?
Yeah,
And
so as
do they always work in that way, or can you do them upside down, or why? How does
they
that work?
always follow that path. Some of our children that are still experiencing trauma and from significant trauma backgrounds, they might take a very long time, if not reach mastery, and they'll float back and forth between depending on what's happening in outside environments. I still have some clients that have been seeing me for 4 years and they will probably have to continue on just to have that extra support. However, we explain to our families right from the beginning it's a child led process, it cannot be rushed. So we can't say to them, okay, your child will be done in 16 sessions, they'll reach mastery, because we can't guarantee that. So that's definitely something that they need to understand in the beginning, that it's child led, we cannot rush it. And we've never had anyone question it as yet. And they do have to trust the process. So once they start seeing some changes in outside environments, it's definitely easier for them to start trusting that process.
So, why those stages? What are those stages about? What do they mean?
So it's to facilitate the change within the child and build that resilience, coping strategies, self confidence, sense of agency. So that's why they need to move through that in their own time. It's similar to it can be similar to an adult starting a new work environment or children starting school. They do still move through those stages naturally. If we go to a new space, we are exploring the space, exploring relationships, checking boundaries and limits. And then we might, once we feel comfortable, show more of our personality where we might have a bit more power and control, be dominant, show confidence, and then move through that. So it's very similar to what we would do anyway, and children do in all new environments. It's just that we have the therapeutic outlet as well of the therapist in the
So,
space.
the aggression, when you say
Hmm.
the aggression stage, that
Yeah,
isn't necessarily being violent and hurting people.
it
It
can be. Though, however, we do set some limits in the space, different to outside environments. So they obviously can do a lot more in the therapeutic space, and that might not be acceptable in outside environments. We do have lots of outlets where they can release aggression onto things like huge, big stuffed toys, our big bag full of air that they can punch and wrestle. We have Nerf guns and swords and pool noodles that we use for swords. So there's definitely outlets where they can release and show that aggression, and it definitely does happen. But they need to know that in that space, we've got to keep them safe and they've got to keep me safe. And if my therapy dog's in there as well, he's obviously another element that he's got to be kept safe. But they can definitely, some clients can really show aggression, and it can be really heavy and last like that for many sessions until they move through that. But
and
yeah, so as a therapist, we just have to sit with them in that, sit with them in those feelings. And we always value that they trust us enough to show us those feelings and show us what they're feeling. And it's transference. They're wanting us to feel how they feel sometimes as well. Mm.
so I guess that's an easy way of understanding aggression.
Yeah,
But would there be more? I guess not all young people do it so
no.
demonstratively. There might be other ways that
Definitely, it presents through perfectionism. So, children needing to have their play perfect or the environment perfect. That might be power and control. So, through a board game, they might need to always be trying to win or have power and control of how the play is unfolding. So, that's how it can present as well. Resistance within the relationship, or settling into play, settling into meaningful play can be part of the aggressive stage as well. So that's what it doesn't have to always mean aggressive or playing with aggressive resources.
so why would a child or young person need to be so controlling? Because I'm guessing you're talking about more than typically developing because all children at some stage
Yeah.
want to be in control, don't they? All children or most children.
A lot of the time, children are seeking power and control because they feel like they don't have it in their outside environments. So it can be things like really heavy routines where everything is way too structured and they're not having enough time to just play and be. So they're trying to regain some of that power back through their play and interactions. It can also be in environments where everything is done for them all the time. They're not building that independence and confidence in their home environments. So they will sometimes flip that in their outside environments and assert power and control on their peers or anyone they interact with to try and feel like they're building that confidence. But it is a false sense of confidence, though.
Mm. Can it be around maybe for children who have early life adversity or trauma where they haven't
Mm.
had kind of structures and boundaries? They haven't had a parental presence, so they've maybe had to look after
Yeah,
themselves.
definitely. And that is their way of getting attention as well. So, from a young age, if they've experienced trauma or lack of connection, that can be the only way they can be seen or heard. So, their little nervous systems have learned that, okay, I've cried, no one's come to me. I've cried, no one's come to me, and escalate. So, that's why they have these really aggressive outward behaviors because that's one of the only ways that they can feel seen or notice. And also, as well, they might just be really hyper independent, hyper aware, and constantly in that fight or flight, where it only takes one little moment for them to become emotionally flooded. And that goes back to their foundation years of when they were developing and their needs not being met.
Yeah, so once you've got through that stage and they can,
Mhm.
I guess, you're building that trust in the relationship, but you're also building trust that you as the adult will actually help them with their big feelings, because I'm guessing
Yeah.
that's what's
And
going on. They've got those big feelings
mhm.
and nobody's really scaffolded them, and they're
Yeah.
coming out in all these variety of ways, and what they're learning
Mhm.
with you in that environment and
Yeah.
hopefully their outside environment is that actually there are adults that I can trust is going to manage and regulate these big
Yeah.
feelings.
And it does take them a long time to build that trust too. We can have children that have seen us for 30 sessions and they might only just within the 30th session allow us to sit close enough to them that they're not triggered by that. So it is teaching them that they are able to feel safe with some adults and giving that feeling of safety and connection that is very unfamiliar to them. So that does feel a little bit unsafe for them at first until they can settle into that. It's just showing them that it's okay to relax and regulate around that feeling of safety. But like I said before, if they're returning into environments where that felt safety is not present, it's we can only do so much. They need to be going into environments where they're feeling that as well to be able to develop further.
Yeah. And then what's the next stage? So after aggression, what was the next stage?
The regressive stage of play. So that's where more nurturing and caretaking themes would present. Definitely a lot less dependency on the therapeutic relationship. They should be showing more confidence, facilitating decisions within the space as well, and leading the play. The children can still play out their aggressive themes in that regressive stage of play, but you would see more elements of control through that and more of that cycle of self regulation and maybe some if they're playing with the therapist or with something else, you might see some nurturing or caretaking themes present as well, not just all aggression unloading through that play.
So when you say regression, do they go back and play younger? Are they filling in the gaps? When you say regression, what
Um,
do you mean by that?
no, they don't regress. So this is the regressive stage of play is where a lot of the therapeutic growth occurs. So it's where they settle into really hard play and lot of the presenting issues come to the surface and actually get worked through. So they're not regressing and going back like developmentally in play. However, they can sometimes as well. And in the transitional stages, they can flip back and forth for a little bit until they settle firmly into that next stage of play.
So when you talk about regression, you're talking about them actually learning the relationship of play, learning the
Yeah, yep.
relationship. That's
And
not,
building those coping strategies that they're needing to build around whatever reasons they've entered that therapeutic space. So
yeah.
it's just building those coping strategies and becoming aware of that within themselves.
So you would move, what I'm understanding is from the aggressive play where maybe they couldn't lose a game or they were frustrated if
Yeah.
they did, if something
But
didn't
they
go their
show more
way.
resilience.
Yeah,
They show
to
more
this.
resilience through that. Yeah.
Yeah, I
So
can
they,
now manage to lose
Mhm.
occasionally, or if
Yeah.
the Lego doesn't go together quite right, I can
Yeah.
either seek help or have another go without chucking it across the room.
Yeah, and they're building those problem solving skills as well and coping strategy. They're still able to show frustration. It's just how they deal with that frustration.
Yeah.
So we will reflect those emotions back to them. And then if they've like, so they were frustrated, you're like, oh, you're really frustrated that you couldn't put that Lego together. But you're, look, you thought of a way. So it's able to reflect back to them, that learning and growth as well within themselves.
And
So
can
it's
they
okay
manage,
until,
they can
sorry.
manage more of that reflection in that
Yeah,
stage
yeah.
and less
So
of it in the aggression
mhm,
stage.
you'd still want them to be able to show any emotion they need to. It's just those outward behavior responses that might not be acceptable. Frustration and anger is still okay. We just need them to know that it's okay to feel like that, but just don't stay like that. And there's ways that we can work around regulating our nervous system through that.
Okay. And then the last stage, what's that
Is
stage?
the
Mastery.
mastery stage. So once they reach mastery, they probably only stay with us for another 3 sessions to transition out. Where possible, we don't like to end abruptly. We want the child to be able to work through the leaving because that can be really tough sometimes. That's where we might see a little bit of regression in that
Yeah.
mastery stage once they know they're leaving because it's hard, but we're there to help them through that. But the mastery stages have complete confidence in the therapeutic space within the relationship. They might be presenting as getting bored with the therapeutic process and what's happening. Lots of changes happened in the outside environments as well. And there will be no intense aggressive things of play present.
Okay. So that sounds quite clear and there's quite kind of a progress.
Yeah.
I'm guessing you don't go from A, B, C, D. I'm wondering, do you go C and then back to B and then, do you know what I mean? That you jump
There is
around a
a
bit?
Yeah, there's a transitional phase in between all of the stages of play. Sometimes children, they'll come in on that first session, even though they're in the exploratory stage, it's very aggressive. So they will be exploratory aggressive and they generally sit in that aggressive stage of play longer. Some of our little children that need that aggressive stage will flip back and forth into regressive for a little bit, and if they've had anything occur in their outside environment that might have triggered them, they can step back. But
Mhm.
once they're firmly in a stage, they tend to stay there unless something significant has happened in the outside
Yeah.
environment.
So that's what I was going to ask next was that
Mhm.
you talked about the environment that they need to be going out in and that needs to be
Yeah,
supporting. So I'm wondering that then if maybe they're in foster care and they move placement, or
yeah.
if maybe they're in a family where it's tricky for the family sometimes, and maybe there's environmental factors within families, would you then see that play out in the play therapy and a change?
Definitely. 100% we see that play out in the therapeutic space. And we where possible, like to have it communicated to us before a session that there's been some significant impacts. Because if we don't, something will happen. We go, whoa, what's happening here? Like, where it's completely different from our last session. And then if we follow it up, we find out that, yeah, something significant occurred. It will always present in the therapeutic
Mm.
space.
And I guess another question I have is, do children role play real life events with you, or do they
Yeah,
just always play abstractly?
no two children play out their inner worlds the same way. It can definitely be very specific. Some children will even verbalize it. However, it can present differently through dominating relationships, just like through animals and things like that, where they're not using it as a specific person, but they're using it metaphorically and playing it out that way.
Mm. And what happens if there's something played out that you're concerned about? What happens then?
So we have to follow our ethical guidelines where sometimes things will need to be reported that have played out within that therapeutic space and followed up.
Okay.
Yeah.
Do you have parents in the space, or is it just the child?
No. So it's just the child and the therapist. We can, however, invite a parent or a sibling in when they're in that mastery stage of play to help foster some connection if that's one of the reasons why they're in that therapeutic space. But we don't invite anyone else in. It needs to be the child's safe space and they need to know that. So children will play differently if a parental figure is around, especially if
Mhm.
that parent or that guardian has been a reason why they're in there as well. It just
Mm.
wouldn't work.
Yeah, which is very, not with a risk yet, but it's very different. I do therapy, which is
Oh, yeah,
always
with the
adult,
family.
not always, but I'd say 95% of the time,
Hmm.
it's always the dyad
Yeah,
of the parent and the child, because it's about building that attachment relationship
yeah,
and helping to fill those early gaps in that maybe they didn't get
yeah,
with the parent or carer that they're with.
hmm,
And it's very attachment based, whereas
yeah.
play therapy sounds quite different in that aspect. And maybe it's
Yeah,
about playing.
they're building an attachment or connection with the therapist. However, it's not, they're working through their inner world. So therapy or something would be a great transition out of play therapy into that. That would be a great next step for some of our clients, not all of our clients, but yeah, so no, it's working directly with the child and their inner world. However, we do have progress meetings and reports where we try and give the family strategies or the school or kindergarten or all the outside environment some strategies to assist that child. But we need to get to know the child first before we can create those individualized strategies.
Yeah. And then you talked about animal assisted therapy.
Mhm.
How does that fit with what you're doing? Because I imagine kids just want to hug the dog, really.
Oh, yeah. Glen is my dog's name. He is new to it. So I've done my training and he's just transitioning in at the moment. It has actually been very magical to watch. It's exceeded my expectations of what I thought it was going to be like, especially with some of my children that have really intense dominance and power and control in that therapeutic space. If I add Glen into the space, they just instantly soften and you can see lots of caretaking and nurturing and trying to keep him safe. It's really beautiful to watch, and it's such a great element to role model to the children connection, keeping things safe. And if Glenn makes a mistake, that's okay. We all make mistakes. It's great to be able to show them that he can make a mistake, but he's not going to get in big trouble for making that mistake. That's okay. We make mistakes. We'll try again. So it's great for them to actually see those things play out.
What would be the reason you would introduce an animal into therapy? What?
I never thought I would ever. My specific reason is because I got a rescue dog. I have another dog as well, but she would not be great for this. I got a rescue dog and he's a little Chihuahua cross and he is the most loving, kind, affectionate dog. Like you cannot love him enough. And I thought, oh my gosh, he would be so great in the therapy space. So I went through my training and then he's coming along with me some days to work. And that's how it unfolded. It was just very organic. I didn't seek to do it. I just thought he would be great. And it does add another element into that therapeutic space. The children won't get to see him every session. That it can be quite tiring for the animal to, he can't be here all day. He can only be here half a day and every second day. So he gets shuffled around a little bit. But it's great to watch the children and have that element and observe that.
And is it, I guess sometimes we talk about the importance of the third thing, don't we? That actually something that breaks the relationship up between the adult and child or the child and whatever. I know in therapy often children need to disconnect for a moment and they might go over to the other side of the room or they might kind of go and find something or hide under a blanket because they just need a moment of disconnection from a relationship that's quite intense and feels a bit odd for them because maybe they don't always experience it. And maybe, I don't know, I was just wondering if the dog or an animal, one is breaks that intensity, but also I wonder if it doesn't feel as threatening to have a relationship with a dog as with
Definitely.
an adult.
And I think it helps that he's a little dog as well. But there is this unmeasurable connection between human and animal that like you can just see play out, especially in that therapy space, where it can just soften children instantly, just having him present. They're so conscious of his well-being because it's instant. It's like instant love for an animal, and they build trust so much quicker with that animal than they would with a human. Yeah, so it is how it's having a third element. He is part of the therapeutic process within himself. He's like another therapist. And the whole session runs differently if he's present.
I know Julie's talked about hers on Therapeutic, but she's got two cats, and sometimes she said that one of her cats, Poppy, will come in, and she's said often we've got very fizzy children who are bouncing around, but as soon as Poppy enters, they just want to connect with Poppy and they want her to stay in and almost can slow themselves down because they know their fast movements will scare Poppy, so they can modulate in relation to the cat where they can't in relation to an adult.
Yeah, definitely. And animals are calming. They calm the nervous system. There's been studies done around just that having that connection or them present are very calming and soothing to adults and as well as children.
So is animal therapy, play therapy, is that something that's widely available in Australia?
There are areas that have animal assisted therapy. We have a lot of equine therapy.
Yeah.
On the ground equine therapy in our area. I'm not going to be using him specifically as animal assisted therapy. He's just going to be an element in the play therapy space. Like I don't plan to use him just as a therapeutic dog just for that purpose. So it will be an element of play therapy with animal assisted therapy combined. So no, I'm the first in my area to do what I'm doing. I was the first in my area to even introduce play therapy. So
gosh.
yeah, we're a bit of a regional town. We're not a big city. So in the big cities, it's more popular. It's quite new in Australia compared to probably even the UK and America. But it's definitely a model of therapy now that is gaining so much traction and so much respect from other supports in the community. So now we get lots of referrals, and we're something they would refer young children to play therapy over other models of therapy now.
Okay. Do you have, I'm assuming you have an association that you are a member of,
Yeah.
and you have to be registered and
Yeah. Yeah. So it's similar around the world, I would imagine. Yeah. So definitely within those NDIS guidelines, if we're helping our NDIS clients, there's some specific criteria for us to be able to charge under certain line items within that and access that funding that we have to, yeah, keep our membership active and also making sure that we're having supervision and doing professional development.
so if people were thinking about play therapy, I guess we've talked about trauma and early life adversity and
Mhm.
neglect and that. And I imagine that most people think about therapy for those, for children who've experienced those kind of things.
Yeah.
Is it, were, are there other times that play therapy might be useful?
Oh, definitely. We have a lot of private clients coming to us because of family breakdown, so divorce or separation. So that's a big one there where play therapy is assisting the child to work through that big, huge life transition. Some school impacts, children that are struggling in the school environment. We're having some issues with our education department over here, and I would assume it might be worldwide, where the school environments are no longer meeting the needs of all children anymore, whereas they're still trying to fit every child into the same category, into the same box, and that's putting a lot of pressure on our children that don't cope in those environments. So we have children come to us because of those impacts of school, sometimes bullying, peer relationships, anxiety, low self-esteem, a huge range of issues why children come to us.
Okay. And would
Mhm.
you work with children who have got neurodiversity?
Yeah,
So, yeah.
definitely. So under our NDIS clients are generally because they are ASD diagnosis, ADHD, global developmental delay, and other complex support needs. So majority of our clients would be neurodiverse.
Okay. And so play therapy fits well
Yeah,
for them, does
yeah.
it? It gives them.
Yeah, definitely. And whereas so generally a lot of those clients are seeing other therapies at the same time. So it's not just us. They might be seeing OT, speech, even psychologists. And we are a space where it's like a big, deep breath, where they
Mm,
get to just be their whole self, and it's not a lot of pressure from a therapeutic perspective, whereas a lot of other therapies are very goal driven and outcomes driven within that therapeutic space. And per session, they get to just be their whole self and in our therapeutic space. So it's sometimes such a more positive
yeah.
experience for them. Yeah.
So play therapy is pretty non-directive, really, is it? So that,
Non-directive. We can, depending, so each client's very different, and that's how we gauge it. So some children need a little bit of a directive approach just to assist in building that connection or exploring the space. And obviously, some of our older children receive a bit more of a directive approach, but it's majority non-directive, all child-centered.
so I guess children maybe who struggle with high demands, or when they're at school and they feel like they've got all these demands going
Mhm.
on, or at home with all these demands going on, I can see then why being in a therapeutic space where
Yeah.
actually there isn't these demands on them, they can just be and have reflected back to them. Actually,
Mhm.
it almost gives their brain a bit of a rest, I
It
imagine.
does. It does give their brain a bit of a rest, and they build that self-confidence in the space as well. And once this is noticed in the therapeutic space, this is always communicated to the family as well to
Mm.
try and adjust some of those routines and just not coping. Because what we're seeing presenting is we've got so many little people with anxiety disorders now, where
Mm.
that wasn't as common 10 years ago, let alone 20 years ago. And that's a huge issue. And their lives are just too busy, too structured, and they're not having enough time to just play.
Yeah,
Yeah.
I think that's what Julie and I did a reflection on we've been doing this for 7 months, and we
Yeah,
last week we had a little think about what what the last 7 months have been like. And one of the biggest things for me that came through was the that most people were talking about the loss of free play. That
yeah,
play is very
yeah.
structured, it's very organized, it's that
Mhm.
children aren't just allowed to be, and that is quite a common theme, I think.
Yeah, and huge. And I do a lot of training with families, like I deliver training to groups of families in education settings. And that's something that I want them to change and focus on in their home environments is meaningful connection and just playing that costs no money. So it's not an experience I had to pay for. We're very lucky here, like getting outside into nature and playing is something that's really important. Parents are afraid to play, I think, now with their children, or they think they don't know how to play. And I always explain to them there's no wrong or right way to play. Just be, it will just unfold. And you don't have to buy every toy in the world for children to play. It can just be kicking a ball around the backyard and building that connection within the family. And that's what's lacking now, too. I do blame technology.
Yeah.
The increased use of technology in our home environments is just crazy. And it is causing a lot of these issues as well, the social, emotional, developmental delays, the anxiety. So, building some very firm and collaborative and strict boundaries with the use of technology in homes as a family is something that I get most of my families to try and establish, and that includes them. So
Yeah.
we're role modeling to our children. If we're sitting on our phones, just disassociating on our phones, what are the children going to be wanting to do?
Absolutely. And I think
Mhm.
also it's that thing of that you can just get the saucepans out, can't you?
Yeah.
And the wooden spoons and let them bang on it. But
Mhm.
I think parents often see on social media all these
Yeah.
amazing things that people are doing, all these amazing
Mhm.
toys that they've bought, and all this amazing. And I wonder for parents if it feels like that's how we should play, and therefore
Yeah.
we're lost, like you say, just going and building a dam in a stream or
Yeah. Yeah.
those kind of
And
things.
a lot of those toys aren't very open-ended. They have one purpose. You actually need a
Oh yeah,
drink. They're, they might be great for a moment,
yeah,
but they're not going to be something that like incites their imagination and then creativity. I say to parents, just like a box full of empty bits and bobs and loose parts can keep a child occupied for a very long time. And I think people shy away from boredom and are always trying to fill their children's time or schedules because they don't want them to be bored. However, I say boredom is great. Boredom sparks creativity and imagination, and children need to be bored more. They're
mm-hmm.
getting everything given to them instantly. So when they're bored, here, have your iPad, go watch the TV, but they actually need to be bored to learn how to play and build some of that, those creative outlets.
Yeah, yeah, and I imagine play therapy gives them some of that space to just use their
Yeah,
imagination, to
yeah.
just sit with something and wonder, what am
Mhm.
I going to do with this? What does it mean? Where does
Yeah.
it can be anything you want it to be.
And it can be a place where they're allowed to be messy
Yeah.
as well. So children, it's something that when I first started this process that I wasn't prepared for, that children really get anxious around mess
Mm.
because they haven't been allowed to make mess. They've always got to keep things clean. So that's something they can struggle with at first is just allowing things to be messy and packing away is something I can do. You don't have to clean this mess, so make as much mess as you like. And they really end up valuing that process.
Mm. I think I sometimes do sand tray, and
Yeah.
I often find the first few sessions, the children accidentally spill the
Mhm.
sand out of the sandbox because the only rule is that the sand stays in the sandbox.
Yeah, testing limits. Yeah.
But they slowly tip it and they're tipping it, knowing what they're doing and watching my face to see what am I going to do and
Yeah.
they stop after a few weeks, but there's almost this testing around, kind of
Yeah.
really explore with this and what happens if it does accidentally go out.
Yeah, so they're just testing limits and the reactions that they might possibly get for doing that.
Yeah.
Yeah. We have sand too. We have sand trays and do sand therapy.
Yeah.
They're wonderful. It's a wonderful outlet.
I'm aware that we're coming towards the end because you've got your day is just starting.
I
It's like to
know.
get my PJs on
You
and
do.
go
It's
to
a late
bed.
night for you.
So you've got a website,
Yeah.
Jasmine. So I'll put on the
Mhm.
on the description of this, I'll put a
Yeah.
link to your website.
Yeah.
If people want to get in touch with you, they can
We
through.
have Facebook and Insta as well if people want to follow that. The
Okay,
Jasmine
so
Cycle.
what is it called? Connection.
Our at handle is just at connections PTC.
Okay, then, and again, I'll put that on the bottom of
Yep.
the transcript.
Yep.
So thank you so much for your time
Thank
and
you so
talking about play
much.
therapy.
Thank
And
you for
yeah,
having me.
all the way from Australia. We are
I
really,
know the wonders of technology.
I know, such a small world now, isn't
I
it?
know.
All right.
Thank you so much. You have a
All
good
right.
night.
And you. Thanks, Jasmine.
Bye.
Bye. Bye-bye.